Good morning. Welcome to Pediatric Grand Rounds. We have a very special guest speaker today, and it is my pleasure to introduce Dr. Benjamin Hoffman. He is the immediate past president of the American Academy of Pediatrics, and we really appreciate his time yesterday working with us on building our advocacy program for the pediatric residents. So excited to have him here with us today. Dr. Hoffman is a general pediatrician and professor of pediatrics at Dornbecker Children's Hospital and Oregon Health and Science University. He majored in anthropology at UC Berkeley, attended Harvard Medical School, and completed residency training at Seattle Children's Hospital. At Dornbecker, he is vice chair for community health and advocacy, director of the Oregon Center for Children and Youth with Special Health Needs, and director of the Child Injury Prevention Program. And today he's going to talk to us about Confessions of a Car Seat Nerd. Everything I know about advocacy, I learned the hard way. Welcome, Dr. Hoffman.
Good morning. It's nice to see everybody. I think you guys are in the early end of Grand Rounds. Some places do it at 8, some places do it at noon. 7:30, good for you. That's fantastic. I'm really excited to be here. I feel like this is becoming a little bit of a second home. Dina and I have known each other since 2018. Met around pediatric advocacy training. So having the chance to be a part of what the incredible work that you're doing here and the amazing program that you're building is really a joy and a treat. Especially great to be here because it's such a comfortable time for pediatricians and kids. Everything's fine, status quo, right? I wake up every single morning, open my phone, and think what fresh hell has been unleashed upon kids and families and communities today. And it just keeps coming. The image on your right is just from this week, where we exceeded we have the highest number of measles cases that we've had since measles was eradicated in this country in 2000. And I think this causes a lot of angst. I know how we feel, because I'm us. And in my current role, I get to go a lot of places and meet a lot of people, and I get to be in a lot of rooms where a lot of stuff is discussed. And I have been accused of being overly optimistic. But I think I'm being realistic because I know us. I know who we are and what we do. And we're going to be okay. And I know we're going to be okay because I know we're superheroes. And I see examples of that everywhere I go. And we see it from our leaders. Representative Kim Schreier is a pediatrician from Washington. She's amazing. And she, in a hearing a week and a half ago, a couple of weeks ago, June 24th, said to RFK's face that he lied. You know what's great? There's a vaccine that prevents this. We rely on the Advisory Committee on Immunization Practices, a panel of experts, to recommend which vaccines people should get at which ages and like. And she ended by saying, I will lay all responsibility for every death from a vaccine-preventable disease at your feet. And our academy, this is one of the things I am most proud of that I have been a part of since I became leadership. Just this week, announced that we're suing RFK over what he's done to vaccines. And there's a lot more to come on this. This is who we are and what we do. We don't often think about ourselves as superheroes, but we need to embrace that role and understand that A, we have power, and B, be cognizant of where that power comes from to be able to help us use it. Because if Superman forgets about kryptonite, he's neutralized. We are, by definition, as pediatricians, advocates. And when I say pediatricians, I should include all child health professionals, anybody who cares about the health and well-being of kids and families in the communities in which they live. We are advocates by nature. I'm a recovering residency program director. I feel like in the past 25 years, I've read 8,000 plus personal statements. I don't think I've read the personal statement of anybody in this room, but it's very frequent I'm in a place where I have. And I know what we write. I know what you say. I know why you decided you wanted to be a pediatrician. And it's because you wanted to do good things for kids. They all say the same thing. When we talk about advocacy, though, it gets complicated because it's a really hard word. This is the definition that I like. And as the advocacy training program is being built here, this is the definition that Dina and her team are operationalizing within the residency program and for faculty, that it's work that we do to promote social, economic, educational, and political change to ameliorate the suffering and threats to human health and well-being that we identify through our professional work and expertise. We have a colleague by the name of Paul Wise, who's a general pediatrician at Stanford, and he said, and I use this all the time because it is the truest thing, that pediatricians are the ultimate witnesses to failed social policy. What we do every day is we sit in rooms and at bedsides and we watch how we're failing kids. And I think we should only be able to take that up to a point. And there's a point where we've seen enough and we need to do something. And what we can do with that advocacy, this work, which is outside of our traditional clinical role to a large degree and upstream in terms of prevention, there are multiple different levels. We are very well trained and very familiar with advocacy at the individual level. I will use it as an example, screening for food insecurity. We can do that. And we can identify families who will tell us that they're hungry for whatever reason. And when they tell us they're hungry, we can help. We can educate, and we can help connect to resources. Have you met the social worker? Do you have the money, the number for the food bank? Are you on WIC and SNAP? Do you have access to all the resources and knowledge that you need? And that's fantastic. But if we're seeing that child for the 15-month check, and they're gonna come back in 3 months, what's the likelihood in 3 months when we screen them again that they're gonna tell us something different? And how many times can we ask the same question before something's gonna have to change? So I've got a colleague who's actually an infectious disease doctor at our children's hospital who recognized that the families who were hospitalized within the walls of our place were hungry because we don't provide trays for parents in general. That's a hospital policy. Caregivers don't get trays. And she recognized that families were hungry. And so she decided she was gonna work on addressing the issue and identified the issue as hunger within the hospital. The solution to that is food within the hospital. The hospital would not pay for trays for families, so she decided to establish a food pantry that would have access, that would give access 24/7 to families to food. And in order to do that, she needed to connect to the food bank to be able to provide support. And so she set up a meeting with the food bank folks, the leadership, and she went and met with the executive director of the food bank, and she called me from the parking lot after the meeting and said, they asked me to be on the board of directors of the food bank. Can I do that? And my response was, you have to do that because that puts you in a position. You have lived experience. You've seen this, right? You have witnessed this failure to these failures to social policy. Now you get to help direct the programs through the eyes of a pediatrician, with the power of a pediatrician, which they've never had before. And that the reason they asked her to be on the food bank that first time, the board, that first time, is because they'd never had anybody who was a pediatrician on the board. The next step for her would be to say, why are families hungry in the first place? And potentially work with planning and zoning or economic development or the city council or county commission to address the orange zip codes, this is the Portland metro area, the orange zip codes of the food deserts to get to the root causes. So moving from the individual stuff to engaging the community to meet them where they are, to then starting to address the social and policy drivers of all of these things. And we can do this, we do this. And we don't all have to do all of it, but it all has to be done. And if it's not us, it's not gonna be anyone. The first most important thing about being an effective advocate is you have to be a kick-ass pediatrician. And this is a really important point in residency because all y'all who are training here, you have 3 years to pick the brains of some of the smartest people you will ever know, to learn everything they know about being a pediatrician. And that includes, there's no universe in which I would remember the distinction between type 1 and type 2 renal tubular acidosis Somebody needs to know that. You need to know what you know and what you don't know. If you're not a great pediatrician, it doesn't matter. And there's a lot of tension often in advocacy training during the 3 years that you are here. I'm looking at the residents now. The 3 years that you're here between wanting to do advocacy and just getting started with it. And the fact that that's going to take away from some of the foundational knowledge. And so thinking about all of these things, the same skills that are required to resuscitate a newborn or to diagnose and treat strep throat, that are essential to the formation of a pediatrician. I think being able to talk to the media, being able to engage with a community-based organization or provide testimony at a legislative level are essential skills in the same way. And we need to think about those as foundational aspects of the pediatric professional identity. Ultimately, and this is a challenge especially now, a lot of our power comes from our science because we have to start with the truth. This gets back to the Superman thing, right? Truth, justice, and the American way. People may not like what the science says. They may try and argue it. They may say, oh, I don't believe it. I need to do my own research. But the fact of the matter is the science is the science. And to the extent that we're superheroes, the science is our shield. This is what our opposition cannot penetrate. And we need to keep that front and center. The minute we let that go, we need to know it and we need to utilize it. We also need to be able to keep to our North Star because it's so easy to get distracted, especially currently, because I think that's a lot of the strategy in terms of how things are rolling out, especially as they impact kids. The North Star has served humanity for thousands of years. The Vikings, the Tahitians, everybody, every culture has relied on the North Star to help navigate them because it's always there and it never moves. Finding your North Star, identifying it and sticking to it is crucial. This is my North Star. This is a sign I have hanging over my door in my office, and that is a pennant that I had made for the board of directors, the AAP, when I took over as the president. And whenever there's a problem or a question or I'm not sure, I go back to, all right, what's going to be the best thing for kids? This doesn't have to be yours, but you need one. So as superheroes, every one of us has an origin story. And I'm going to share a little bit of mine, and through my origin story, highlight a lot of lessons that I have learned about pediatric advocacy, most of them through making mistakes, to be quite frank with you. My wife is also a pediatrician. We trained together in Seattle. We had experience at the end of medical school and then during residency during our one call-free month on the Navajo Nation in northwestern New Mexico, and we fell in love with it. And when we were done with training, we went to work with the Indian Health Service in a place called Gallup, New Mexico on I-40. Many of you may have driven through it. It's the kind of place that if you drive through it, you're like, people live here. This is where it's located, about 90 miles south of the Four Corners. What I'm showing in the image on the right is the lighter area is the Navajo Nation, which is a sovereign nation, which is with its own government, its own laws. To the south is the Zuni Pueblo, which is a different sovereign nation with its own government and its own laws. And Gallup is this little island of New Mexico that sits within this sea of these two sovereign nations. On a Tuesday, the population in Gallup is like 17,000. On a Saturday, the population is about 100,000 because people pour in from the surrounding areas because that's where Walmart is and the laundromats and the movie theater and the flea market and stuff. The county in which we lived was among the poorest in the entire country. 45% of kids lived in homes that had income below the federal poverty line. At the time we were there, between 96 and 2000, about half of the families that we worked with had access to electricity. About 20% had access to running water. And this was early in the cell phone era. Only about 5% had access to a telephone. People would drive for hours to get to us, often on unkept dirt roads that would wash out when the rains came. A beautiful community, a tremendous amount of strength and power, but talk about victims of social policy. This is how the Indian Health Service works in the Navajo Nation. That's the map. It's about the Navajo Nation itself is about the size of West Virginia. The population on res is about 250,000, and you can see it's divided into 8 administrative service units around healthcare, and we were in Gallup down in the bottom right corner. If you ever have a chance to go, it is among the most beautiful places on earth. Incredible. Monument Valley, Shiprock. The bottom left is Church Rock, which is about 5 minutes from where we lived. But this was the reality of many people who lived there. And I'm not putting this up to demonstrate deficits. I'm just putting this up to demonstrate this was what life was like. This is where we worked. This is the Gallup Indian Medical Center, which is a hospital built by the federal government in 1961, that in 1997 looked and acted exactly like you would expect a hospital built by your federal government in 1961 to look and act. There were weeks at a time where we could not go in through the main entrance because the facade was falling off, and it literally would take an act of Congress to fix it. We had 14 pediatricians, a 37-bed inpatient unit, a 5-bed level 2 nursery. We attended deliveries. We had a clinic that saw 55,000 patient visits a year, and we would provide consultation to the emergency department. When we were on call, which was 1 night a week and 1 weekend a month in general, there was a pretty good chance you weren't going home. And I'm not saying this is just the way that it was. I will also say this is, without question, the best job I will have ever had in my life. So you know how everything looks better in retrospect? So do I. Behind that handsome young doctor is the trauma bay in the Gallup Indian Medical Center. And I had an experience the winter 1996 to 1997, 5 straight call nights. So basically 1 month. Every night I was on call, I got called to the emergency department to help stabilize a kid who'd been critically injured in a car crash, none of whom were restrained at all. And I remember standing right there after the 5th one saying, something's got to change. I was pissed as hell. Somebody has to do something about this. And then realizing I have no idea what to do about any of this. I don't even remember a lecture on child passenger safety. And I think we've all had those experiences where we identify a problem and then we realize, oh, this is too big. I don't even know where to start. And that sort of paralysis of the infinite is, I think, pervasive within healthcare in general, but especially within pediatrics. And for some reason, and I still don't know why, for some reason, this was a problem. I'm like, I got to do something about this. Einstein said the difference between stupidity and genius is that genius has its limits. One of the things I learned early is you should always assume that somebody way smarter than you has already looked into this problem. And either they figured it out or they haven't. And you can learn from both of those things. How you identify those people and programs and how you connect with them is challenging because that can be intimidating. The day after post-call, I started making a list of all the things I knew I didn't know about car seats. And you can make a list in your head. You're starting to think about those things. I didn't know what the AAP said. I knew nothing about best practice for car seats. So I went to, this was pre-Google, so it would have been Alta Vista or Ask Jeeves or something like that. And I found this policy statement on car seats. What our academy says, this is what you're supposed to do. And as I was reading through this and then starting to look at other literature, there's one name that came up over and over and over and over again, and it was Marilyn Bull, a neurodevelopmental pediatrician at Riley Children's in Indiana. Of all people, she was the queen of car seats. And I found her email, and like at 3 p.m, I sent her an email saying, hey, I'm this dorky pediatrician in the middle of nowhere. I want to talk to somebody about car seats. Literally 3 minutes later, I get an email back from her. Here's my phone number, call me. And I called her, terrified. And she said, we've been waiting for you. I said, what do you mean? She said, we need more people who are doing this work. And I'm so glad you reached out. And she told me the things to do. She said, look at your state law. There's going to be some organization in your state who handles occupant protection, so seatbelts and car seats. There's going to be somebody who has a program through Medicaid or something else, the Department of Transportation or Health, that distributes car seats. You've got allies like AAA and all of these things, and I took notes, made lists, and I started looking at what was already out there. It turns out the Indian Health Service has an injury prevention program. I didn't know that. I called them. They're like, yeah, we've never heard from a pediatrician before. We would love to talk to you. And they introduced me to a person who was going to end up being my partner in this. At the direction of Marilyn Bull, I looked into who the nonprofit was or who the organization was that did occupant protection. It turned out to be a nonprofit called Safer New Mexico Now, based in Santa Fe. And they did car seats. They managed a distribution program for Medicaid that it turned out my hospital had, but none of the pediatricians knew about it. They trained car seat technicians. And I called them up and I said, hey, I'm a pediatrician in Gallup. And I got the same response. Oh my God, you're a pediatrician in Gallup. We've been dying to talk to somebody in Gallup. We've never talked to a pediatrician. Can we talk to you? And we set up a meeting. They sent somebody out the next day and we got a cup of coffee and they're like, here's what we can do. Marilyn Bull told me I needed to become certified as a car seat technician. Knew nothing about it. This organization did it. 4 days, I will never get back in Albuquerque, New Mexico, at temperatures of 104 degrees, learning how to put in car seats. 4 days. The certification is still 4 days. I'm still certified as one of the only physician instructors in the country, and I will continue to do so. This changed me because I saw firsthand how hard it is, and I also saw that there are people out there, like there's a team that's there. One of the things we didn't know is why. Why did I see 5 kids who died in car crashes, or who were critically injured in car crashes, totally unrestrained? What drives use or non-use? And so I asked myself, why are car seats not being used? What's up in this community? Is it that people are transporting other things that they think are more important than children and having them transported safely? I looked at the law. This is what the law said between 1990 and 2001, that kids under the age of 1 needed to be in a car seat, which it turns out aligned with AAP policy. Once you turned 1, though, a car seat or a seatbelt was adequate. And once you were 12, you were completely free to be a projectile in the rear seat of a vehicle. And this was a problem. And I knew this needed to change, but I also knew, I know even less about this part of the world than I do about any of the rest of it. My assumption about why people didn't use car seats in Gallup, New Mexico, where over 40% of the kids live in poverty, is that people were not rich like Britney Spears and couldn't afford car seats. This is a picture of Britney with her oldest son, making a poor choice. And so decided to find out, is that the issue? We took care of every one of the babies who was born in our hospital, came back to our clinic because there was nobody else. And we did a chart review over 6 months. Every baby who was born in our hospital, did a survey when they came back for their 2-month, surveyed them when they came back for their 2-month check and asked them, do you have a car seat and do you use it? And what we found out is 116 out of the 117 families did. And the one who didn't, because I knew about the distribution program, we got them a car seat. We also asked them where they got their car seats. Because in Gallup, pre-Amazon, if you can imagine that, there were only 2 places within 90 miles where you could buy a car seat, and that was Walmart and Kmart. That was it. Almost over 3/4 of the families bought their car seat at either Walmart or Kmart, which totally surprised me. About 1/4 of families got them from the hospital program that none of the pediatricians knew existed, and the rest of them got them as a gift. And when we asked them, what makes it hard? What do you find challenging about using car seats? They said it takes space in the car, and we drive long distances and we have a pickup truck or whatever. They're expensive and they're hard to use, which we all knew. So the problem was not people not having them, they weren't using them. So we decided in order to advance this, we needed to know if they're not being used, how bad is it? And it turns out Safer New Mexico Now, as happens in every state, is responsible for doing seatbelt surveys and car seat surveys. And they will, once a year, send out trained teams to stand on street corners in different towns that are randomly selected to look into cars to see what seatbelt and car seat use rates look like. And so we talked to them. They taught us how to do that. And we decided we were going to do that in Gallup. And we wanted to do that in a place where there would be a lot of people, which it turns out was Walmart. When we were there, the Gallup Walmart was the second busiest Walmart in the universe. And right by Carl's Jr. was the entrance that almost everybody used to get in and out. That was the corner. There was a stoplight there. Every car had to at least slow down, if not stop. And we decided that was the corner we were going to use. So I went out on a Saturday in December I think the ambient temperature was 20, in a big puffy down jacket, and it looked something like this. And I stood on a step stool and I looked in people's cars, and I got yelled at a lot. And what we found out is that 29% of the cars that we saw that had kids in them in only 29% were those kids restrained. And this confirmed to us, we have a problem. How are we going to figure this out? We need to go to the community and ask them. And we need to build a team, because if we're superheroes, we need other superheroes, because our powers may not be enough, because except for the guy who just shoots arrows, everybody has their superpowers. And as a team, they all synergize. Not that it always works well. Often there's conflict. And we learned how to build a team to get everybody in the boat and ensure that we're all rowing in the same direction. And some of this involved bargaining with the firefighters, for example. They really cared about fire prevention. And they said, okay, if we help you with this, will you work with us on a smoke detector program? Absolutely, we'll totally do that. Every good organization, every good program lives and dies by culture. And because that drives behavior. That is all set by values. Everybody needs to be aligned in those values, defining it very clearly so that everybody knows where the rules are. Everybody at least acknowledges the same North Star. I took my experiences and used it as I became interested in the art and science of how we teach pediatricians to be effective advocates, and developed this tool, the project planning tool. This starts with identifying the community you want to work with and identifying your mission, your vision, and values so that you could articulate that to other people. This is crucial, because just because it's important to you and just because you feel this way about it doesn't mean other people are. And the more aligned you can be, the more you're going to be able to be successful. We knew nothing about about the art and science of injury prevention, for example. So we spent time learning about injury prevention. And we learned that there are really three key drivers. You can persuade people to do things, education and incentivizing the right behavior. You can enforce things, so you can establish laws or rules and then make sure that there are processes to ensure that people follow them. Or you can do things that automatically protect them, change the environment. If nobody drives, nobody's going to die in car crashes. That's not going to work, right? But car seats and seatbelts and airbags and all of that, and street lights and all that sort of stuff. We knew that the engineering environment stuff was way out of scope for us. We also knew that because the law was so poor, that enforcement was going to be complicated. Although if you look at the efficacy of these things, the single best tool to change behaviors around injury prevention is enforcement. So we really wanted to focus on that, but knew that that was the thing that was going to be hardest for us. We were going to really move towards education and then making it easier for people. So we started to look at the community and say, who might care about this? Who might have a dog in this fight? Who's going to join us? And I found this thing from the social work literature called the community wheel. And you can see there's a bunch of different organizations: faith-based community, the education system, recreations and parks, civic volunteer organizations. And we mapped out all of these different groups in terms of, all right, who are we actually doing this for? And we decided that was the community. Who's going to take ownership of this, or who has power to change things within the community in terms of leadership? And will help drive things forward? We need them to be on board, but we're not going to ask them to do stuff. Who's going to fight us, and where's the competition? So we started with law enforcement. We had 4 different law enforcement jurisdictions: city police, county sheriff, state police, and the Navajo police, because it's a sovereign nation with their own independent legal system, and fire EMS. So we reached out to them. We reached out to the healthcare system, to the community hospital, the Navajo Department of Public Health, and the New Mexico Department of Health. We reached out to where the kids are, to the education system and the early education system, including like childcare, private childcare and public childcare. We made connections with the business community because that's where the power and the money was. One group that I didn't think about were the civic organizations. And one of the nurses in the emergency department, turns out, who had been present for several of the kids who were critically injured in car crashes, was a member of one of the Kiwanis clubs. And he said, hey, I heard you're interested in doing something about car seats. I hate that too. Why don't you come and talk to Kiwanis, and maybe there's something we can do to help. So I went and presented to them, and they gave us a check for $300. We had no idea what to do with, but at least it was something. And we had some recognition. If you get invited to Kiwanis, the next thing that happens is you get invited to Rotary. So I went and did the same presentation at Rotary, but they didn't give me a check. But what I got is a bunch of business cards from the guy who owned the radio stations in town in English, Spanish, and Navajo. I got the business card of the mayor. I got the business card of the publisher of the newspaper. And that came in handy later on, because those were old men with power and money and resources. And those connections were invaluable. Because there were only 2 places where families could buy car seats, we decided we wanted to talk to them to see if they would help us at it all. And I went to Kmart first, which was in the mall, because I thought they were the underdog and maybe they'd be more motivated, and got nothing. I went to meet with the manager at Walmart, crappy cup of coffee in the radio cafe, and said, we're interested in doing something about this. He said, that would be fantastic. What do you want to do? Do you want to use our parking lot for like educational events, and I can bring out the hot dog cart and we'll get a radio relay and we can do that? And I said, I love you. And he said, and car seats are expensive, aren't they? I said, yeah. He said, what about if we sold car seats at cost through a coupon program? And I said, I love you. And he said, all right, here's the deal. Let's go back. We're going to talk to our baby section manager. I'm going to have you pick one of each of the types of car seats, a rear-facing, a convertible, and a booster seat. And we'll make sure we have a pallet on hand at all times that we will sell at cost plus a little bit. If you will manage a coupon program so that we don't have to worry about that, and give me data back that I can send to corporate because it makes us look good, and I have metrics around community engagement. So there's some mutual benefit here. So we did. We set up a coupon program. And you can see the cost of the car seats relative to what had existed before. We numbered all of them. We sent them out in the community. My experience becoming a certified technician was transformative. And I met the community of car seat nerds in New Mexico. And as we started to work with the community and think through the issues and listen and have conversations, we decided what we needed to do is bring expertise to the community to help families utilize car seats better. So we had Safer New Mexico Now come out to Gallup for the first time ever and train 27 other people to be car seat technicians. This is a Gallup police officer and a community health worker from the Navajo Nation at that training in 1998. We got a little bit of money from the injury prevention program to create public awareness. And we decided we were going to do monthly car seat clinics at Walmart on Saturday mornings, where we were going to help families utilize their car seats right, make sure they had the right seats. If they didn't, help them get them. And we set this up so this was going to be that I had done the survey in December of 1999, and we started the program it was December of 1998, and we started the program in January of 1999 with monthly car seat clinics. Took out my business cards that I had gotten, talked to the guy at the radio station, and he said, great, if you're gonna do this, we should put on public service announcements. I can play one every couple of hours during the month, and then when you're having events the week before, we could create ads for those, and we'll play them once an hour. And he said, you're going to have to come down and record them. I said, I don't know how to do that. He said, come on down. And we wrote them together, and he made me record them. I still have a cassette tape with all of the, which I do not share with anybody. I called up the newspaper and said, hey, we're starting this program. You know that kids in Gallup are not buckled up at all. And we got the lead story on in the Gallup Independent on the weekend to build awareness, talking about how bad the law is and how the law shouldn't determine it. The picture that's on the right-hand side is one of my favorite pictures of all time. So this is a 9.5-month-old. This car seat was legal at that time. These are no longer on the market. 9.5 months old, being buckled into her seat in her family's pickup truck. 9.5 months old. What direction is she supposed to be facing? And she's facing forward, right? And I don't know if you can see just above her head to the right is a gun. Yeah. Not the message I might have wanted to send, but it was cool nonetheless. And we started doing these car seat clinics. I'm sorry, yeah, we started in November 99. I was wrong on the timing. In those 12 events, we worked with over 800 families to ensure that they had the right seat that was used correctly, and the families that didn't, we got them almost 300. We sent out 2,000 coupons into the community, and 612 of them were redeemed, which is, I didn't know anything about this. That's a pretty impressive rate. And then we went back at the end of this first year and did the same stupid standing on a step stool in a big puffy blue jacket getting yelled at and having things thrown at you to be able to replicate. And what we found is at the end of that year, car seat use rates had doubled. Still terrible, but a lot better. And this, like, I remember analyzing, looking at this data. It wasn't complicated data because I am not a smart person when it comes to data. But it was like, oh God, what I can do in an exam room is important, but this, right? And this led to a phone call in 2000 about the car seat law. Safer New Mexico Now was partnering with AAA, and they were going to take a run at improving the car seat law. And they asked if I would be a part of that. I said, great, I can help you think through that. I have no idea what it takes and what needs to be done. And it reached a point where they said, we need you to come, would you be willing to come to Santa Fe to the Capitol to testify? And I said, what does that mean? And they said, we need you to talk about the numbers and how important this change would be. I'm like, all right, I think I could do that. So I started to put together numbers and all that sort of stuff. And this was what I was going to lead with. Car crashes kill more kids than anyone else. I had all the numbers there. And I was ready to go in with the science, with the shield, to say, here's why you need to do this, because kids are dying. Car seats decrease the risk of death by 71%, for infants, 54%. For older kids, booster seats decrease the risk of injury or death by another 60%. These things are incredibly effective. And I had an epiphany. The day before I was supposed to go, I had this whole thing written. It was full of numbers. It occurred to me that my youngest son was 11 and a half months old. So I took him out to the minivan and put him in a car seat, and I said, that looks stupid. Took a picture of this, and I talked about the numbers a little bit, and then I held up this picture. And the chair of the Transportation Committee said, how come you didn't tell us about this sooner? And it passed unanimously. And we got a law that required then car seats up to age 5, and then something for everybody else. It was no longer allowable to be unrestrained in the rear seat. And in 2004, the same group came together and said, this is not okay. We need a booster seat law. And they asked me if I would draft it, because they said, you're the expert. I'm like, I don't know. I said, right, just tell us what you think the best thing would be. Write it down, and we'll turn it into legalese, which they did. And it just so happened that my youngest son, same kid, was just about to turn 5. And if you brought him out to the same minivan in the same seat and put him in a seatbelt, this is what he looked like, with the shoulder belt coming across his neck and the lap belt sitting right over his belly button, so that if he's catapulted forward at 60, 70, 80 miles per hour, he's going to die. Yet you put him in a booster seat, which took all of 10 seconds, and all of a sudden everything works. And we got that bill passed. And this was another aspect of, all right, now I can't not do this. And I need to teach other pediatricians about this because I had no idea. And what I learned from that is that this is what we do, that this is woven into the DNA of every child health professional, that the science, as I've said, is our power, but that is absolutely essential and completely insufficient. Good advocacy comes from passion, meaning it's something that's meaningful to you, that will allow you to make the sacrifices necessary to do this. Because I didn't get paid for any of this work. This happened on weekends and after hours, and we can't build programs ultimately on the backs of martyrs and saints. But if you're passionate about it, it at least gives you an entree. It's a long game. My George Clooney moments were in 1996, 1997, and we didn't start the program until the end of 1999. I am not a patient human being. Learning to be patient was huge. Realizing that you're never alone, there's always somebody out there who's willing to help you with expertise, with sweat equity, with money and resources. And that while data and science are crucial, absolutely essential, they don't win hearts and minds. It's all about stories. I also learned repeatedly that you need to be ready to fail, because the work is really hard and it's complicated and you're gonna fail a lot. But if you're gonna fail, it's better to fail small than fail spectacularly. And so figuring out what that looks like, starting small so you can fail small, regroup, pick yourself up and move on. When I go back to the principles of injury prevention, as I said, the most powerful tool, the most effective tool is enforcement. So we went to the police and said, the law sucks. We'd love to change it. Is there anything we could do to help you between now and whenever that happens to make your lives easier? And they said, yeah, we already write over 1,000 citations a year for people who are not using seatbelts or car seats. About 80% of them get dismissed because they go to court and we're too busy and they get, we're already at capacity. There's nothing more we have to give. And so we came up with an idea. And we said, what about if we put together a group who's out in the community to identify kids who are unrestrained in cars? If we did that, would you be able to help us identify where those, like the address of the people who own those cars, so we could send them some information and resources? This was, nobody had access to internet stuff at that time. So we took part of our $300 and we made these pads. I still have a big stack of them at home. And when a family was identified, the police would give us, we'd submit a list and the police would send us the address, or we'd get the address, and we would send them information. This was a draft of the letter we would send if they were younger kids. Dear mom and or dad, I know you love me and only want the best for me, but I wasn't restrained. And I know you want to do better for me. There are these nice people who want to help. Signed, your baby. You know who this is? I know this is a generational thing. Dina, who is this? It's Milli Vanilli with their Grammy Awards, which were taken away because it turns out they couldn't sing, and they lip synced and had somebody else behind the scenes actually doing the singing. There was a point that this seemed like a good idea, right? Because it won them Grammys, but ultimately it destroyed their careers. And the Milli Vanilli principle, this idea that you think you have a great idea and it's not gonna be, is gonna grab you all the time. Going back to these pads, where would you be with your pad doing what at a time when you would see kids in cars unrestrained, unless you're dumb enough to stand on a step stool at the corner at Walmart? You're driving in your car. Didn't think about that at all. And so we recruited 50 plus people to be part of this, and they all came back and said, I would love to do more. I see this all the time. I can't write things down and I don't remember. I'm like, crap, that was a dumb idea. Looking at the community wheel, we talked about competition, opposition. Understanding who's gonna be there to do this to you for the dumbest reasons, power or perceptions of power, money, turf, just because they're being jerks. And you never know who it's gonna be. It could be your dad. I love that one too, thank you. I'll be here all week, try the veal. 2007, New Mexico did not have a helmet law for anybody, including motorcyclists. There was no appetite for a helmet law for adults, but we thought, what about a helmet law for kids? There was data from Seattle that they were incredibly effective, so we had the numbers. We had families with stories about traumatic brain injury and all this sort of stuff, so we put together a bill, and it passed. But it turns out the public was not terribly enthused about it. And the day after it passed, this was the story on the front page of the Albuquerque Journal saying that kids hate this. And the sheriff of Bernalillo County, where Albuquerque is located, was quoted, Darren White was quoted as saying this in that article: I'm very concerned that the government is trying too hard to become everybody's parent. When you think about smoking cell phones, helmets, at some point you have to say no mas. We're limited in what we can do. Where does it stop? I'm just being honest. Helmet law enforcement is going to be a low priority. Who would have thought the person responsible for public safety would be saying, we're not going to do this? We never saw that coming. We should have thought about it, but we didn't. We failed. And people fought us like this was the Darth Vader thing. If you're going to get invited to the table, you need to make sure you understand where the table is, who you're eating with, and what they expect. If you get invited to this Thanksgiving, you have a sense of what you might bring, right? Probably something casserole-y. If you get invited to this Thanksgiving and you show up with a really expensive bottle of wine, not the right thing. You need to understand the audience and the community. So I will go back to that same place in the emergency department several years later. Saturday afternoon, got called to take care of a kid with this just because the rest of the ER was hopping. And then an hour later, there was another one. And an hour later, there was another one. And I found out the first one. Why? What happened? Oh, well, it's the weekend of the Eastern Navajo Fair, about an hour east of where we were. And today's mutton busting. I had no idea mutton busting was a thing. Turns out it's a big thing. Let's put a toddler on a pissed off sheep. And what happens is they fall. Nobody had any idea, like nobody at the hospital had ever thought about this. I had a colleague, another pediatrician who's now by the name of Nelson Branco, he's up in Marin County, who was at Shiprock at that time. And when I was working on car seats, he was working on bike helmets. And I called him and I said, do you know about this mutton busting thing? And he's like, yeah, it's ridiculous, right? I'm like, we got to do something. Some kid's going to really suffer a significant injury. I worry about traumatic brain injury. He's like, yeah, we should. Let's think of it. I wonder if they'd wear helmets. So the next year, we went out to the Eastern Navajo Fair, and set up a table with a bunch of helmets. With the idea, there was nothing in the literature about what helmets would be appropriate. We just brought the helmets we had, with the hope that the parents of mutton busters would actually care about it. And what we were told is, no, thank you. Please, we mean you don't, no disrespect, but you know how to leave. We had not even asked anybody beforehand, like, is this even what would your reaction be? And if we had asked, we would have learned. We thought we knew the answer. Turns out now, mutton busters regularly wear helmets because things changed, but that stung. And it helped me realize, we're experts in what we're experts in. We know exactly what to do for strep throat. We know how to identify it. You know before you walk in the room, right, what the likelihood is based on the vitals and the little bit of the one-liner from the MA or the nurse. And if we suspect it, we know how to test for it. If it's positive, we know exactly how to treat it, right? And we tell people, we write prescriptions, orders. I order you to do this because we own this. We are the experts. We cannot write a prescription for advocacy in communities. We are not the experts in communities, even if it's where you live and the community that you feel you're a part of. You cannot assume that you understand and you can speak for them. So being able to do things with communities as opposed to communities. The car seat stuff we ended up doing with because we had a long enough runway and we knew we needed a lot of resources. The bike helmet thing, we totally biffed. People say nice things about kids, right? No, there are very few people on earth who would tell you, I hate kids, I wish they would just go away. People are willing to do nice things. People are willing to say nice things about pediatricians who are or child health professionals who are trying to do effective advocacy. But at the end of the day, you will end up getting a lot of bedbug letters. This resonates when I'm in the South. Dina from the Midwest gets it. The term bless your heart sometimes is good, but sometimes it's the thinly veiled like F you, right? Oh, bless your heart, right? Bedbug letter is basically the bless your heart for advocacy. And it comes from a story that is probably partially apocryphal, but I think also that I've read enough to think that there's some truth behind it. A pig iron salesman, which it turns out that's a precursor for iron necessary for steel manufacturing. In 1889, needed to go from New York City to Buffalo to make a sale. So he took the train up, made the sale, killed it, absolutely destroyed it, and decided, wow, I did great. I'm going to travel back in comfort. Instead of the regular train, I'm going to take a Pullman car, which was the epitome of luxury. This was the lie flat bed in first class on Emirates in 1889. Right? It didn't get any fancier. Paid the extra money, had this posh room, had a great meal with wine and all this sort of stuff, went to sleep in the super comfortable bed, and woke up in the morning covered in bed bug bites. And he's like, you wouldn't think that would happen. They should know about this because they probably would want to make sure that other people didn't get bed bug bites. So he decided to write a letter to George Pullman, the president of the Pullman Car Company. He said, "Dear Mr. Pullman, my name is Phineas Jenkins. I've had this experience. It was absolutely lovely. But unfortunately, when I woke up from a sound sleep in the morning in the comfortable bed, I was covered in bed bug bites. And I thought you might want to make sure that this didn't happen to other people. Thank you very much. Signed, Phineas Jenkins." And about 2 weeks later, he gets a letter from the Pullman Car Company, and he opens it up. And it says, "Dear Mr. Jenkins, thank you so much for bringing this to our attention. I assure you we are appalled, and our customers' comfort is the most important thing. We promise you we will address this. Thank you, thank you, thank you." Signed, George Pullman. And he felt really good about it. Like, I have made a difference. I'm going to change things. And as he's going to throw out the envelope, he noticed there was something else in it. And he pulled it out. In residency in Seattle, the only level 1 trauma center is Harborview Medical Center in Seattle for the entire state. And as a second year back then, you were the only pediatrician in-house for the level 1 trauma center. And your job was really to protect kids from the trauma team, to make sure, because they wanted to do paracentesis on everybody, right? Thanksgiving of 1991, I was totally down in the dumps because I was alone in this place on Thanksgiving. And I got a call, a trauma alert, that a kid was being flown in from Eastern Washington, ATV crash. And what had happened was, this is not the actual family, and I'm hiding their identities, but this had happened. An 8-year-old girl was riding with her older brother in front of him on the ATV. It went up a hill, and the ATV flipped over, came back, and the handlebars hit her square on the bridge of her nose. And her face was like broken eggshells. I don't remember how long she was in the hospital. I don't remember how many surgeries she had. She survived, but suffered some pretty significant injuries. And this bugged me. This really bothered me. Later that summer, because I'm a huge baseball nerd, I was at a Mariners game, sitting in something like these seats up in the nosebleeds on a Saturday. My wife was on call. It was just me, so I went. And I'm sitting next to all these kids from this summer camp, and it's driving me nuts because I'm trying to watch the game, and they're just, they're throwing things and yelling and screaming and super distracting. The Mariners have a mascot who's a moose. And there was only one point in the game where I noticed those kids were quiet. And it was when the moose came out on an ATV. And he rode around, and the kids are laughing and screaming. And then the moose crashes the ATV into the center field wall and falls off, and the kids just lost it. It was the funniest thing they'd ever seen. And I'm like, well, that's all kinds of wrong. Somebody needs to do something about this. So I called up the Mariners on Monday, and I said, "Hi, I'm a dorky pediatrician at Seattle Children's. I want to talk to somebody about the moose." And they said, "Oh, you want Brett, the moose coordinator." Great, send me to Brett. So I talked to him, and I'm like, "What do you think about a helmet for the moose?" He's like, "That's a great idea." And so he started digging in on it, found out that the Mariners would do it if the helmet was made by the costume company that made the costume, so it was consistent. It would cost about $5,000, and they weren't willing to pony up the money. So we started looking at where could we get $5,000 for a helmet for a moose. And it took forever. In working with the Mariners, I realized the Philly Fanatic and a bunch of other mascots did the same thing. They rode around on ATVs without helmets. I'm like, I'm going to reach out to Major League Baseball, Bud Selig, the commissioner of baseball. And I'm going to write him a letter and say, hi, I'm a dorky pediatrician in the middle of nowhere in Gallup, New Mexico. And I've been working with it because I was in New Mexico at that point. I'm working with the Mariners on trying to find a helmet. What do you think about this as an issue for Major League Baseball? And I got back a letter signed by the commissioner of baseball on baseball letterhead, which is like, oh my God. It says, thank you for the letter. I appreciate your very unique idea and am moved by the sensitivity of the idea. However, I urge you to continue to work with the Mariners. It's better if you do that. Thank you for taking the time to write me. I enjoyed your very thoughtful letter and the marvelous plan you've come up with. That's who it was addressed to. Dear Dr. Gallup. And this was not in the envelope, but I think this is what he told his secretary. It was clear he didn't care about this. It was all pro forma. It took 5 years. We did get the Musa helmet. It was sponsored by one of the healthcare systems. Long game. Like, I don't know what difference this made. It made me feel better, and it certainly sets a tone. This was not something I would have spent a gazillion, like if this is what I had done for my career, I think that would have been wrong. You never know where the opportunities are going to be. You never know where the problems are going to hit you and what's going to hit you. And the best things happen when you least expect it. My favorite car seat consultation ever. I was in clinic at University of New Mexico. I was precepting, so I'm sitting at the doctor's desk charting or something like that. The phone rings, somebody gets it, says, hey Ben, it's a call for you. I'm like, okay, who is it? It's the zoo. I thought, are my kids on a field trip? What did they do now? And I went to the phone and said, hi, this is Ben Hoffman. And they said, are you a car seat person? I said, yeah. He said, could you put a gorilla in a car seat? I asked why. And they said, well, there's this baby gorilla, 6 weeks old, who was born in Denver, and her mother refused to care for her. And so we're adopting her, and but I have to hand raise her. This is the curator. I have to hand raise her. And I live 3 miles from the zoo, and I have to transport her back and forth every day in the car. And I don't think I can do it unless I know that she's like not going to be able to move around and all that sort of stuff. So I got a car seat, and we went down, and I met Tuli Vu. And we fit her in the car seat. The size was good. Everything fit. I could get her snug and all that sort of stuff. Did not think about the fact that not only does a 6-week-old gorilla have the strength of probably 10 men already, but she also has prehensile toes. And while a baby's not going to be able to reach here, a gorilla can, and unclip both here and there. So we had to do some modifications that would not be approved by the National Highway Traffic Safety Administration. But it worked. I feel like this is how we spend every day, rolling the rock up the hill like Sisyphus, condemned to do that every single day. We come to work, we're going to push the rock. We come back the next day, the rock's in the same place because we see the same problems over and over and over and over. And what happens? What would happen if one day we come in and the rock is an inch closer than it was the day before? And the next day, the rock's another inch closer and another inch closer. It doesn't get it up the hill, but we're starting to see some progress. We're starting to see that we have value and we can make a difference. I feel like this work, which is advocacy, for us is the vaccine against burnout that will get us back to the why we wanted to be child health professionals. Going back to the North Star. Knowing that it's always there and being able to rely upon it. This was a picture from my summer vacation last year in southern Colorado. It's the Big Dipper. The sky there is gorgeous. And if you know anything about astronomy, you can use the Big Dipper to find the North Star. And I remember this night thinking, I'm going to look for the North Star. And it turns out, if you draw a line from the two lowest stars, and you go from Dubhe, which is how it's pronounced, I checked, and draw a straight line, you get to Polaris, which is the North Star. And so I did that. I followed that line. And I followed that line, and I couldn't find the North Star. And that happens to us all the time. This is a huge problem. Things are really bad. Hashtag today, right? I'm just a dorky pediatrician from insert your place here. How am I going to be able to make a difference? Because the goal, the thing that guides you may feel like it's gone. But the North Star is always there. And if you wait long enough and you practice with kindness and grace and a sense of mission, it will show up and it will be there to guide you because it's always there. I will end with this picture. This is Tuli Vu. She's 21 years old, still alive, at the Detroit Zoo. I encourage you, I've not had the pleasure of going to visit her at the Detroit Zoo. She was in Albuquerque for 8 years. I'm super grateful for this opportunity. I'm sorry for running over a little bit. Thank you for the privilege of being able to share some of my stories that hopefully will help you become the pediatrician that you need to be, and more importantly, the pediatrician that kids need us to be. Thanks.
Thank you, Dr. Hoffman. So inspiring. You're probably my favorite dorky pediatrician. And I forgot to mention, this is like the second annual Dr. Hoffman Grand Round. So we're hoping for maybe a third next year. For those that are still available, questions? Any questions? Also, we can ask him afterwards. Let me bring you the mic. It's a safe place.
Hi, good morning. I just wanted to thank you for this awesome talk. I'm sorry I missed the first one. I work in trauma services with my colleague Lauren Sutherland, who's
Awesome.
laid an amazing foundation in injury prevention. We feel you from the CPSD course of the 5 days that I actually cannot get back either. But thank you for the advocacy, because this truly is like a labor of love and injury prevention. And it's a unique position that is, I feel, the glue from the community to the hospital. And coming from the ER, where I was kind of like, oh, like now I'm like installing car seats and helmets, and this is such a huge like difference of what I used to do. It is realizing that this is an unconventional way of providing healthcare to the community that is truly the upstream of healthcare. So thank you so much for a wonderful presentation, and just kind of encouragement to keep, doing the uphill battle. So thank you so much.
I love that so much. Thank you for what you do. I think you hit the nail on the head. There's this gap between healthcare and what's valued in healthcare, and especially how we're valued. I can bill for my time to take care of a patient. I can't bill for my time for helping them with a car seat. And it's now the single leading cause of death for youth, because unbelievably it's now firearms, as everybody knows. But wouldn't it be great if the trauma service was just super bored? It'd be incredible. Let's work our way out of a job. What if there's an epidemic of health, and all of a sudden, right? But that's not how things work, and that's certainly not how the values are demonstrated within healthcare. We're valued for generating RVUs and moving rooms, and even though I can do the same thing as you, I would be valued differently and paid differently. So I'd love to talk to you afterwards, because we've done some work around adaptive needs car seats, and I think we're on the cusp of something really cool. So stick around. I'd love to talk to you a little bit.
Hi, great job as usual. I got to see you last year, so
Thank you.
And really fun and funny and engaging. So love that too. Question.
Can you tell my kids that?
Sure. Is there not I guess this is my, own misunderstanding. Is there not a federal car seat law
Yeah.
that like across the
There's-
board, there's a standard, and why is that?
There isn't, and there won't be, because that's the domain of the states. The federal government regulates manufacture and features of vehicles and car seats. That's through the National Highway Traffic Safety Administration, and they're incredibly tightly regulated. But every state creates their own law, and so we need to go state by state by state. And we've seen tremendous change over the last 25 years. The tragic thing is, and I don't have this data up there, but if you look at between the mid 90s and around 2010, 2012, motor vehicle deaths for kids under the age of 19 decreased by about 40%. But since then, since about 2013, totally flat. There has been no change at all, except for the last couple of years where I started to see an uptick again. So even though every state has car seat laws, they're very tightly regulated, they're reasonably well enforced. There are a lot of programs out there to help families access appropriate use. Even this year, in 2023, which is last year we had data for, around 35% of all kids who died in car crashes were totally unrestrained. They're amazing, but they only work if you use them. There's still a lot to be done.
All right. I believe Dr. Hoffman is available, so if anybody has questions and wants to talk afterwards. Thank you, Dr. Hoffman, again, for a very inspiring talk. I have one last question for you.
Yes.
For someone who wants to, what's your call to action or charge for someone who is maybe feeling hopeless and wants to do something? What is one small thing they could do today to start to advocate in a way beyond the bedside?
Try to find where your friends are going to be. Somebody out there cares about this. And so realizing you're not alone, and that especially for those of us who are docs, we feel like it needs to be us. It doesn't need to be us. What we can bring, often the best thing that we can bring is our power and our expertise to supplement. Not being intimidated by that sort of paralysis of the infinite, and just starting if it's the thing. There's no universe in which I ever expected to end up being the car seat guy. That problem found me. For the residents and people, in early career pediatricians, that thing may not have woken you up in the middle of the night and said, you got to do this. This is the thing I'm going to keep you up until you figure this out. Wait for that to happen. There are skills, there are still things you can do, right? Engage, especially supporting others and getting engaged. But just not giving up and recognizing that this is what we do, to borrow from the NRA, who told us that guns were not our lane. F&A, it is our lane. And we're going to take it and we're going to do it. And nobody's going to stop us. And I think just having that attitude and finding your friends. And you know where to find. Now that you know me, you can't not know me. I'm easy to find. Call me. Like, I will be your Maryland Bull. Like, we've been waiting for you. Doesn't have to be car seats, whatever it is, your thing. Cool.
Thank you so much. Another round for Dr. Hoffman.
Thanks a lot. This has been so much fun.